Okay, let's go.
Love is not all you need to sustain a marriage. Before you say I do, ensure your health and your partner's health with these 7 most important medical tests. That way, you are securing your future, the future of your babies, and again, you're setting the foundation for a happy marriage. Because so many marriages, it's about, I didn't know this, I wouldn't have. And by the time you don't do the needful by doing this important test, there are consequences and there are outcomes that sometimes your energy might not carry it, and it could wear you down and put you in agony for the rest of your life. So let's dive in. In today's video, you're going to learn those tests, those essential tests you are meant to do, whether as a man or as a woman. Let no one convince you otherwise. Don't be confused. You need to do the needful. The world is not the way it used to be. Okay? You really want to set the tone right. So let's dive right into it. Number 1 is do your blood group test and your rhesus factor. Blood group is different from knowing your rhesus factor, and it's the rhesus factor that is where the cocoa is. The rhesus factor is talking about the negative or the plus that usually comes with the blood group. That is where the rhesus factor comes in. So to know your blood group, whether your blood group O, B, AB, okay, is really important. Whether you indeed is a rhesus positive or rhesus negative, it's important. Particularly for women, being on the negative rhesus factor, it means a lot for your pregnancy. So you want to make sure you really know this so that you get the appropriate medical support when the timing is right. So, and many people mistake their blood group with their genotype. Your blood group and your genotype, they are not the same thing. Blood group, like I stated, is about whether your blood group O, A, B, AB. While in genotype, it's about whether you're AA, AS, SS. Can you see the difference? Okay. And again, you need to equally do genetic testing. This is where genotype can actually come in. Genetic testing will reveal deeper than just knowing your blood genotype. You can take it a step further and actually find out if there are any abnormality in the genetic line. For people that are in advanced country, it's not about you running away from that relationship. It's about you knowing whether you're prepared to handle what will come out. Predisposing factors for that particular person you want to tie the knot with. It's important. So the third test on the list is know your HIV status. Know your HIV status so that you can really start to take appropriate treatment and make sure that you don't transfer it on to your newborn baby. Okay? Then your hepatitis B and your hepatitis C is important because these two in particular are transferred through blood transmission, similar to the way you get HIV. So it's important you know it. And because it impacts that liver, our liver health, it's important you know your standing. So do the screening, the hepatitis B screening, the hepatitis C screening, and your HIV status screening. It's very important. Transmitted disease screening, STD, STI. These contribute hugely to infertility. Many people enter marriages with chronic infection. So know your status. If you're dealing with chronic infection, it's better you get it treated rather than just going into that union and begin to deal with the side effects later. So it's important you do that. That way you're able to actually find out if you're dealing with conditions, infections that can affect your fertility, like chlamydia, then E. coli, yeast infection. But the truth is that all of them are highly treatable. You don't just walk into ignorance and begin to delay some of the processes, some of the things that you want to see start happening in your marriage, like the pregnancy. All right. Fifth test that you should do importantly is to do a thalassemia test. In Nigeria, I don't think we are doing it currently. But in developed countries, you can access thalassemia tests, okay? It actually pinpoints to see if there is any genetic traits, because in thalassemia, that person struggles to make hemoglobin. If you have like a recessive gene for it, it could get dominant in your child. That way you are able to know how to manage that condition. So the sixth test is do your fertility testing. In terms of your hormonal profile test is important. Know if you're dealing with high prolactin, whether your luteinizing hormone, it's okay, your FSH is okay. Some women even go to the extent of knowing their ovarian reserve through doing AMH tests. So it's important. Men, you can do your sperm analysis. Stop hiding from this test. Men are hiding a lot from doing this sperm analysis prior to marriage. They will just keep a blind eye, and once they enter and the woman is not able to get pregnant, and that's when they will start dragging their feet. Do it on time. And the thing is that you must not even tell your partner you're checking yourself out. You can go and check yourself out by yourself. Just know your status so that, yes, you can handle things. Quick recap is do your blood group, your blood genotype, and your rhesus factor test, okay? Know your HIV status. Know the status of your hepatitis B and hepatitis C. Do fertility testing. Do thalassemia tests. Know do your infection status. Know it, okay? So with this test now, you will not be blindly be doing things. You want to do things the standard, the proper way, and reduce the risk of had I know. He wish above all things that you and I prosper and be in good health, even as our soul prospers.